All right, time for our daily crisis update. We got a mix of some not so great news and some little bit better news for you today. Let's start, as we always do, with the case numbers. All right, so we can see here in the U.S., 336,000 cases and close to 10,000 deaths at this point. Worldwide, well over 1 million cases now, 1.2 million, 70,000 deaths. And always remember, take these numbers with a grain of salt, both because of the lack of comprehensive testing in some places and from the lack of transparency in other places. But this gives you, of course, a general sense, Saagar, of where we are at this point.
Yeah, I mean, it's troubling. You see that doubling numbers around 3-day periods. There's some hope currently that we can eventually flatten the curve. But for now, it continues to go on an upward trajectory, and worrying news out of places like New Orleans, out of Detroit, burgeoning hotspots there. Lack of testing, of course, continues to be the main variable. And then New York State continues to be the epicenter of the outbreak. We'll hear from Governor Cuomo later today.
Yeah, and yet, insanely, Wisconsin still having a primary tomorrow.
Still having
totally irresponsible and
mystifying.
crazy.
And then across the Atlantic, our cousins, couple of developments over there. Boris Johnson, the prime minister, actually has been admitted to the hospital. He tweeted that he's, quote, in good spirits, but number 10 has stopped describing his symptoms as, quote, mild. So now he has had, they're calling him persistent coronavirus symptoms 10 days after testing positive for the coronavirus. So he'll be staying one night in the hospital. They did not deny that he'd been given oxygen treatment. We don't yet know, we don't really know the full scope of his health there, but it's not a good situation. I mean, from a public perspective, you know that he fought as hard as he could from having to go to that hospital.
Absolutely.
Because that just undermines a lot of confidence in the system. Very troubling there to see that. Cabinet meeting has been postponed, and Britain, and that actually came on the same day that their deaths were the highest ever, actually there in the United Kingdom. And actually, over the weekend, mirroring kind of the state of the crisis, the Queen actually gave only her fourth national broadcast in the history of her reign. Let's actually take a listen to a little bit of that.
I'm speaking to you at what I know is an increasingly challenging time. A time of disruption in the life of our country. A disruption that has brought grief to some, financial difficulties to many, and enormous changes to the daily lives of us all. I want to thank everyone on the NHS frontline, as well as care workers and those carrying out essential roles, who selflessly continue their day-to-day duties outside the home. I hope in the years to come, everyone will be able to take pride in how they responded to this challenge. And those who come after us will say the Britons of this generation were as strong as any.
Yeah, I mean, it's a historic moment, really, whenever the Queen decides. I mean, she was recalled in her address speaking during World War II, times of national crisis, Britons sacrificing for the. I mean, this is language that you just haven't heard, since she really became queen in the 1940s, like in the post-World War II era. And it's really just a new way that we're starting to think about our public life. And I'm actually just glad that we have a historic figure like that who can kind of bridge the gaps, because I think so much of America, I saw this observation happening whenever they started asking people to social distance. And eventually the reason that we had to do stay-at-home orders because people weren't complying is that it's been so long since our government ever has asked citizens to sacrifice anything.
Right.
People kind of forgot how to do it.
That's very well said. It's very true. And at the same time, it's also been a long time since our government's really had to sort of marshal the nation for any kind of a national response, and at least here at home, not going as well as we would like. But we do have a little bit of good news for you today, so this is exciting. Spain and Italy, which of course have been very, very hard hit, they seem to be making some progress, at least in terms of leveling off the number of new cases, which of course is really critical. And this is what was interesting information. And again, always take these numbers with a grain of salt. They're not precise, right? Because we don't always test absolutely everyone. Things can be underreported, et cetera. But it looks like the trend is in both Spain and Italy, about 21 days into their lockdowns, they were able to see this flattening off and even somewhat of a decline in new cases detected. So that gives us some hope that if we continue to follow the regimen, if we continue the social distancing, if we continue to stay at home as much as we possibly can, that we should not be too far away from seeing a similar flattening off, which of course we haven't gotten to just yet.
No, not yet, but it is good. There's a lot that's going on here, which is not only that, but this really starts the question of how do we really re-enter social life and all of that. And I think that is really, we're going to be looking very closely at different nations that are kind of past the peak of their epidemics to see who is using what mechanisms in order to get people back to work and not ensure that we have a second wave of the outbreak.
Exactly. And yet there's warnings coming out from our government to brace ourselves.
And that's at the same time, we have this terrible warning message from the Surgeon General, who's on Fox News Sunday with this very sobering, dire message. Let's take a listen.
Well, it's tragically fitting that we're talking at the beginning of Holy Week, because this is going to be the hardest and the saddest week of most Americans' lives, quite frankly. This is going to be our Pearl Harbor moment, our 9/11 moment, only it's not going to be localized. It's going to be happening all over the country, and I want America to understand that.
So there we have it. I mean, he says this will be a Pearl Harbor 9/11 type moment. I think the forecasts, we don't really know what it will be, but some models showing as much as a peak of like 2,500 deaths in a single day over a period. And when the cases start to double up or double every couple of days like that, you're going to see a prolonged, really 2-week period. This is according to the models, which, by the way, have some problems, have not necessarily been accurate, but no matter what, I mean, the horror that we're seeing in some of these epicenters of outbreak is going to be terrible for the country. It's going to be hard.
We already saw our deadliest day ever over the weekend, and unfortunately, I think we'll continue to see those trends. But as we've been saying, the better we follow the guidelines, the more states follow suit, the better people, make sure that they're staying home as best as possible, the quicker that we can get through this, and the fewer deaths that we'll ultimately have, which is really what this is all about.
Certainly.
Thank you all so much for watching today, and we will have more for you tomorrow.